Welcome to Dora Wirth Language's mini video series in which we address the linguistic aspects of some of the most important clinical and regulatory challenges faced by our customers. This week we're looking at submitting a centralised marketing authorisation application in Europe. Navigating the European regulatory submission process is key to our business, and every month we're called upon to translate and update product information, or PIs, in time for EMA submission deadlines. Let's walk through the key linguistic milestones on the pathway to submission and the support you may need along the way. At day one, you'll have a first draft English PI. At this point, you may begin to plan the linguistic stages of your application. Planning ahead will ensure a smooth path to submission, particularly if you have to schedule in-country reviews by local affiliates. You'll see how important this is later on when the deadlines become tighter. Between day 1 and day 120 or day 121, you should also ensure that your PI is compliant with EMA QRD templates and guidelines, as well as EDQM and MEDRA terminology. Better to iron out any non-compliances before you have to deal with 24 separate languages later on. At day 150, you can give the green light to your language service provider, or LSP, to begin translating your English PI into the 24 languages required for each centralised MA. Any updates to the English PI between day 150 and day 210 will need to be reflected in the target language translations. It's a good idea to have 24 up-to-date translations before CHMP opinion and the 5-day window. The 5-day window begins on day 210, and you must ensure that any changes to the English PI following a positive or conditional opinion from the CHMP are incorporated in the 24 translated versions by day 215. Depending on when opinion is received, this deadline can be tight. If you have local affiliates who need to review the translations after opinion, we suggest you discuss this well in advance so that expectations can be managed. The translated PIs are then distributed via UDRALink to local health authorities for review, and by day 229 they will make available to you any comments on their local language version of the PI. Your LSP should then review any comments from the health authorities for accuracy, QRD compliance and consistency, and come to agreement with the local health authority wherever possible. The most efficient way to approach this step is to allow your LSP to liaise directly with individual member states to reach agreement. They should then complete all relevant sections of the QRD Form 2. Finally, by day 235, you'll need a submission-ready package of annotated and clean Word files, bookmarked PDFs, QRD Form 2, correspondence with local health authorities, and submission checklist ready for submission to the EMA. We hope you found this timeline useful, and should you need any clarifications or support during the process, feel free to reach out and ask our expert team for advice. Thank you very much.